Good morning. This is Merlin Gonzalez. This is a 125th edition, monthly edition of Table Talk. And we are here at Eskenazi, here on 38th Street. And we're going to talk about FE.A.S.T and also health equity or health engagement zone. And you have heard about it. We talked about it a couple of months ago, and we're going to revisit that so that we can share more information about what's happening here in Northeast Corridor of Indianapolis. So it's very exciting. So before we start, we'll start with prayer, and then we'll get on this 125th episode. God, we thank you today for the opportunity to serve you and serve your people. Thank you for providing our needs and providing for others. Pray, Lord, that you will guide this conversation and be with us and give us wisdom as we continue on to proceed in this very important project. In Jesus' name, amen. All right. Here with me is Greg Garrett and also Tierra, and she was with us a couple of months ago. So I'd like to start first with Greg. If you could introduce yourself, your organization, and what's happening here in the Northeast Corridor.
Okay. Good morning, everyone. My name is Greg Garrett. I am the Deputy Director of Unite Northeast Community Development Corporation. And our organization on the Northeast side is to enhance and develop the Northeast Corridor through different projects and programs and construction, which includes also economic development projects like the Cook Medical Manufacturing Facility, the 80 Fresh Market Grocery Store, and the upcoming Horizon Bank. So we do a lot of projects and programs throughout the Northeast Corridor. One of our bigger programs that we've done in the past has been homeowner repair. So our partnership with the Health Engagement Zone is to be somewhat of a convener for the Northeast Corridor, in addition to working on each one of the three projects, including the FE.A.S.T project that we are going to talk about later on today.
Wonderful. And Tierra, would you introduce yourself, please?
Absolutely. My name is Tierra Pinkins. I'm the Director of Health Outcomes and Cultural Engagement for Health and Hospital Corporation. That means I am working with Health and Hospital Corporation and with Eskenazi Health as the director to implement our health engagement zones.
All right. Before we continue on, I'd like to give some introduction about what's happening at Faith, Hope, and Love and also in the community. On April 11th, we're going to have our first annual Run to End Hunger. When we talk about hunger, I believe that in this country that hunger emotionally, mentally is one of the main issues as far as hunger is concerned. There are actually many people who are more desperate, emotionally and mentally than physically. There are a lot of food pantries here, but again, today what we're going to talk about is all of those, not just the physical, but also the mental wellness and the sustainability of not just the program, but also of the recipients. And also maybe we can expand the program in different parts of Marion County. So that's why this Run to End Hunger is coming up April 11th at the in the northwest side of town, but not too far here in the Martindale Brightwood area. It's called Fitness Farm, not too far from FHL office. So that's one of them. We are also establishing FHL University in Kenya. You will hear more about that. We have 7 community leaders and pastors who are graduating just this July. And God willing, I'll be there to perform or to lead the ceremony and meeting with different churches and also different businesses and establishments there to hopefully establish a physical FHL University in Akala, Kenya. So, Greg, Tell us, you mentioned several things that UNEC is doing in the community. Could you tell us about the correlation as far as the FEAST project and also what's happening in the community?
Okay, so there's a lot of things happening in the community. There are several major topics and issues that we can discuss. But I'll start out with the first part of your question with the correlation for the FEAST program. So several parts of the Northeast Corridor at a time was considered a food desert. And how we began looking at some of the options about what goals that we would set through the health engagement zone started with our convening meetings that happened around 2022, 2023. When this building was still under construction, actually, we held several meetings with the community at the YMCA in the Avondale Meadows, and there were discussions had that created a robust list of community goals for the health and wellness of the Northeast Corridor. And through those conversations, one of the things that was brought up a lot was the food insecurity and then also the quality of food. If you look in the Northeast Corridor right now, you'll see a lot of fast food restaurants and gas stations and other areas where you may not get the best and most nutritious food possible. We're very happy that we have still the Save a Lot in the corridor and also Indy Fresh Market grocery store. But at the time, Indy Fresh Market was not quite finished yet. So what they were talking about was it being a food desert. I think a lot of people still feel the pain of the Kroger shutting down in Devington. I think that happened around 2018. And for that, they wanted, not only access to food, because you can get hot chips and Cheetos and big gulps and everything from gas stations, but they wanted fresh food, fresh vegetables, fresh fruit, good, stocks of meat that they can purchase that's healthy. And then also too, we had partnered years ago with Dip In, which is a diabetes impact project. And they were showing that a lot of the people in this corridor do suffer from health issues like diabetes, heart disease, high blood pressure, and so on and so forth, gout, and other health ailments. So one of the things that we wanted to also do and bring as a goal is how can we bring healthy, nutritious food that would improve not only their appetite and what they eat, but also their health and wellness. And so that came from those discussions, and eventually that formulated and was distilled into the FEAST project. But some of the things going on in the community, we're definitely still dealing with, higher utility costs. Now with the cost of gasoline going up, economic wellness and economic health in the community is it's not as good as it should be, especially with the conditions of a lot of things and programs being closed. So we're still following that, still following the utility issues that are coming up. We have pushed for the AES public means, but as you know, those were canceled. So we're trying to work with them to see if we can get some more going up to have a conversation with the community and their organization. Also, things that are going on in the community. I would be bereft to say it's in Martindale, Brightwood, but there's a general fear in every corridor is the new development of data centers. I think everybody has that on their mind, how that's going to affect their utility bills, how that's going to affect everything that is their livelihood, their health and wellness, especially with some of the complaints of noise and other forms of pollution. So those are one of the two major things, but there's also, lack of housing. That people are still trying to struggle with, trying to find affordable housing, and then also being able to go out and be homeowners. There's a huge barrier here in the city for home ownership as well. So there's several things going on in the community, and we are definitely looking forward to any other further programming that may occur, and then also being partners with the city of Indianapolis and other organizations and government entities to see how we solve some of these problems in the future.
That's awesome. A lot of things are happening here in the Northeast Corridor. You talk about not just food insecurity, but also the anxiety, the doubts, and also uncertainties what's what's happening, not just in our city, but in the entire world.
Right.
So with that, again, we would like to let the public know that there are many organizations who are coming together to alleviate some of these things that's happening, the uncertainties, and we don't know what the future is going to bring. But we are positive in thinking about that because not only one organization is really putting this initiative together, but several organizations. So I'd like to introduce Autumn, Lori here, and she's one of the partners in this initiative. And if you could share, what your organization is all about, and introduce yourself, Autumn.
Yes, hi, I'm Autumn Lowry, former community builder for UNEC. I'm the owner and founder of From the Ground Up Foods, which is a local urban farm in the Northeast Corridor. We took a space at an old abandoned school and turned it into a farm to address the area's food access needs. I'm currently working as an intensive case manager again at Horizon House, coming back after 4 years when my passion for food first started. So glad to be here and looking forward to the conversation.
Wonderful. Yeah, we'll get back to you, Autumn. I'd like to turn to Tiara. And Tiara, we were talking about this deeper issue as far as not just hunger, but actually the impact. So I'd like to start first with, why do you think the main purpose of the initiative that was led by Health and Hospital and also Eskenazi?
So I think the main purpose of this project, like Greg said, we're really focusing on food access as a social determinant of health. So when we think about things, especially health outcomes, we know that there are things, it is the things that are outside of the healthcare system that really impact your health. So having access to food, to good food, is very important for your health.
Mhm.
And one of the things and one of the reasons also while we're working in this area is because there's a life expectancy disparity. And so with that disparity, we are working in areas of town where there is a commitment from the community. There's a commitment from our health centers to really come together, work together to try to solve for some of these issues that were identified in our health engagement zone planning process, which is what Greg talked a little bit about earlier.
Yeah, you mentioned about the life expectancy. I know we talked about that a couple of months ago. Could you share that again? Because that's very, very important, not only in what we're talking about here, but for the Northeast and also for the city of Indianapolis.
Yes, so when we started this work, what we were looking at is thinking about the difference that 16 miles makes. So 16 miles equals 16 years. So roughly within the areas that are on the outer outskirts of Marion County of Indianapolis have a higher life expectancy. And then so once you get into specific closer inside the county areas, there are disparities with the life expectancy. So people are expected not to live as long in their counterparts in other zip codes.
So if you live in Marion County, your life expectancy is less than the suburbs.
Yes.
And one of the social determinants of health, probably because of the food insecurity. Now, Greg, you've been a resident here of Indianapolis. Could you tell us your observation as far as what is the correlation between food insecurity and maybe the life expectancy, and why is there a big gap within 16 miles of Marion County?
Oh, that's a big question. I will give my best assessment. So with food insecurity, the health, the social determinants of health really show life expectancy changes with some of the diseases that are intergenerational within certain communities in Marion County and frankly across the country. Usually you have a higher expectancy to have high blood pressure if your mother or father have high blood pressure. You have a certain expectancy to have diabetes if you have family members with diabetes. The same goes with heart disease. With food insecurity, you eat where you can. And a lot of times you'll find out that if you have a family of 5, and let's say you work 2 jobs, you don't have the time to get home, cook a freshly cooked meal with vegetables and starches and meat. Usually you'll go to down the corner where there's the fish and chicken place, or you'll go to a McDonald's, or you'll go to a KFC, and you'll get your food from there. And if you eat at those places constantly, it raises your risk for those types of diseases to manifest. There was a child obesity problem that we've been dealing with all over the city of Indianapolis, and that's due to the foods that, is available to them. I don't know how many times I see kids walking from the Avondale Meadows Middle School or Tinley in the Meadows area and go straight to a gas station to get chips and pop every day. If you do that for years, that has an effect on your health, and it is just what is there. There's not a farmer's market in the area where people can get apples and grapes and pears and peaches. Most of the time, historically, around this corridor, you'd have to wait for the peach truck to come every summer so you can get your fill of peaches, and that was a 1 or 2 time deal. But you can always walk to a gas station and get a Snickers bar. So definitely, if you look outside the county, I don't remember when was the last time they put a Whole Foods in 46226, 46218, or 46219. But you can definitely find a Whole Foods either central downtown Indianapolis or in the surrounding counties. I think the options for fresh fruits and vegetables are limited in these zip codes, and that's why you have that 16-year correlation.
Yeah.
Especially from growing up around here, people used to go to the Kroger in Devington.
Mm-hmm.
There used to be a Mr. D's on 56th Street.
Mm.
There used to be a Joe Amalia's Food Market right up the street. Now there's just a Walmart there, and that change really affects a lot of people because when you lessen the options of where people go, or you spread it out even further, and sometimes those options aren't on a bus line. So if you have no transportation, you're going to go where you can go to get food the closest that you need to go, or you're going to go where something is on a bus line. Yeah. And so transportation is also key in these situations on where people choose to eat and what they choose to buy. And, sometimes too, growing up on the Northeast Corridor, growing up in a family, an African-American family, I begged them not to eat chitlins and pig feet anymore because of how unhealthy it is. But that's a struggle too, because people love that type of food, and it's a cultural
I love it.
But boy, isn't it not good for you.
No, it's not good.
Yeah, it's to a point now that I have family members that now don't eat pork. So it's really turning around, but it's turning around slowly. But I think that there would be better impacts to people's health if they had more options for fresh vegetables and fruit and other items that is a leaner, healthier type of meat.
That's a great insight, Greg. So transportation, we're talking about people, food pantry is good, but if people cannot go to food pantries, so now you have the desperate or the people that are really needing it. So Tiara, that's part of the program that we're going to talk, that we are about to launch, is the delivery of food. And also, if you have something to add to what Greg mentioned earlier.
Absolutely. So what we are kicking off is our food engagement and access through strategic touchpoints. Those strategic touchpoints, we're thinking about not just physical grocery stores, but how else can we reach people that otherwise may not be able to have access to food or healthy food? So in this project, we are really focusing on people that are transportation burdened, maybe homebound, and making sure that we are able to provide those that vital, nutritious food to people so that they're able to continue to thrive. I think one of the things that's really important about what we're doing is that we're working with our community partners on this. So I can't say enough for Greg, for you, Merlin, and then also for Autumn as our community-based partners, because you are able to really touch the community. You have deep relationships with the community. So being able to partner for this, we think is really important for sustainability. And then also so people understand this is a program for us, not just built on top of the community as well.
That's wonderful. We are talking about Autumn. So I'm going to ask Autumn. Autumn and I, or our organization, had been working together for more than 2 years. I started with Dipin and also with LISC, the Food Access Initiative. So Autumn, could you tell us your experience as far as working with us, working with the community in the past, and also what you're looking forward in the future?
Yes, hi. I couldn't thank Faith, Hope, and Love enough for their partnership. We couldn't do what we do without them. We've built a great program that we can replicate. We started with Diabetes Impact Project, and we started making healthy meal kits. So every month through DoorDash delivery, which goes through Faith, Hope, and Love, we're able to put together healthy meal kits where they get fresh produce when it's in season from our farm or from the grocery store when it's not. We try to access Indie Fresh Market when we can. But basically, we put together a full recipe, a full meal, and then extra stuff to fill the bags too. But, we try to include fruits and vegetables. We try to include things like yogurt, just kind of wholesome, healthy food that's not really available in our area. So we're really excited about branching out and partnering with Eskenazi for the F.E.A.S.T project and expanding on what we're already doing. So hopefully we can reach more families and create, lower that 16-year difference. So
Autumn, so what is your main part on this program?
So I'm the farmer, and also I'm still always going to be a community builder, and so I networking, reaching out, trying to build other partnerships as we expand this project. Just making sure like we gather the groceries, we find donations, we harvest the food from our farm, and I put together and I print recipes. We put them in the bag for the clients so they can make. Hopefully, everything is in there for a full meal or almost.
Wonderful. So I'd like to get back to Tiara. There's a term that says prevention is better than cure. So from the health perspective, could you elaborate on that, and can you connect that with what F.E.A.S.T? By the way, what is F.E.A.S.T also?
Okay, so I will take that question in 2 parts. So I will start with, I'll go a little bit more for F.E.A.S.T. So like I said, it's about engagement and access through those strategic touch points. And so with the program, we are really focused on proving that this is a model that we can replicate, that's really going to provide a service that's needed to this community. And so what we're thinking about as far as impact for this program, we really want to also, we're putting a big emphasis on measurement of what we're doing, so that we understand what the impact is in the community. So we want to understand not only things related to food, but things related to health. And then we're also looking at how we can involve our health system and our community health workers to make sure that there's really more wraparound support and resources for those that are able to participate in this program.
Yeah, you mentioned something there about the data. I worked around, and for almost 2 decades with food pantries, and they're doing a great job. Kindness, sometimes without questions asked. But I think kindness without accountability over time enables people instead of empower people. So, and there is also sometimes a stigma that when people are being asked, the participants are being asked those questions, that they may not be, able to answer them or would not answer them. So, in that premise, why do you think data is very important? And also, what do you think the community as a whole can do to earn the trust that, hey, we are not here to exploit you, but we are actually here for your benefit, and also not only to receive, but also to give back in the future?
So I'll touch on 2 points for that. So with data, one of the most important things is that we are able to collect information on what we're doing so that we can make changes, we can improve what we're doing. So you're not able to change what you don't know. So you definitely need to measure what you're doing. I think we do like to communicate as well that we are collecting all of this information just to show that we have an impact. So one, we want to show that impact to the community. So we want to be able to share some of that data out that shows this is what this type of program can do for the community. Really helping the community to understand, take some ownership of what's going on, but then also that makes a case for us for the future, for sustainability and for funding, which is very important for any of these initiatives. We have to have a way to support what we're doing. And when you have the data that shows that this is effective, that we're making improvements, that people are satisfied with what's happening, then that just helps us with that sustainability piece.
Yeah, that's change is hard for people. So whether you're a participant that's being asked, feel secure and be trusting that this is really for the benefit of not just your family, but also for the community, because data tells a story. Actually, with our homegrown Saltview food access management software, there's some statistics that we found out that a person going to food pantry, not considering the amount or the worth of food that they're receiving, but also for the healthcare, they save at least $1,823 each person, not each family. So you put that into perspective that food pantry, and I'd like to encourage our food pantries also, that you're not just there to give away food, you are there actually to give hope to people. Because in the process of giving, you actually start to understand the status, or what's happening in the community, and with that in mind, we work together towards better, processes. Somebody says that expecting a different result in doing the same thing is insanity. And I'm not saying that we are insane about this, but we have to be open to technology. We have to be open to understand even more the power of data, because it can change not just the system, but it can change this generation and in the future of the generation ahead of us. So, Greg, on that, I know that you work a lot with the community, and you probably gather some data from the community in order for you to be more effective in as a convening entity in the Northeast corridor. So, could you tell us a little bit as far as what is your bend as far as the data collection, analysis, and reporting?
So thus far, for the data collection, we're using the information that we get to start working on our quality of life plan for the Northeast Corridor. There hasn't been a survey that has gone out yet this year. We're currently working on a survey to collect data from the neighborhood organizations and other community groups for 2026, just to get a feeling on what their expectations are, not only for food insecurity, but other aspects of the quality of life system here in the Northeast Corridor. But a lot of the times when we collect data, we really have to take their word for what they're saying, because a lot of data that is collected is almost anecdotal. You can always get their age, their age range, their sex, those types of information just off of a spreadsheet or just off of a checkbox. But really what we want to do as far as collecting data and then also report back are the real-time social effects of living an everyday life here in the Northeast Corridor, which is very important to us, because the only way Indiana is known as a state as having one of the lowest quality of lives in the nation for individuals. So we really want to hone in on how can we make their day-to-day lives living in this community better for them, and how can we turn information that we gather from them into data so that we can report that out. A lot of times too, especially from a community development corporation, we use data to try to go for grants or find out programming that's needed in the community. And you really can't obtain those grants without substantial data about the community that you serve. So we also use that information to report to agencies like CICF, LISC, and other organizations that are potential grant providers. Another one would be INHP. So usually we do data collection as much as we can. We don't want to over inundate them, because if a lot of the times when you're dealing with community groups, you get the same. And this is unfortunate. I wish more people would come. And I would say on this call, if anybody that lives in the Northeast Corridor, find out who your neighborhood association is. Find out who those presidents are. Find out when those meetings are and go to them, because there's a lot of useful information that you will receive there too. We're not always gathering data from you or having researchers come and ask you questions. We're also providing services to the community to let them know what they can do for like end of life care. That was just at the Sheridan Heights Neighborhood Association meeting on Tuesday. Last month, the Audubon Gardens Neighborhood Association talked about reverse mortgages. So we're definitely bringing information to the community to educate them on other programs that may make their lives better. But again, we do as an organization collect data so we can be sure to know what we need to go after as far as funding to improve the program and the lives of the people in the community.
That's wonderful, Greg. I'd like to acknowledge those people who are commenting about this. Somebody said excited about this program. Greg, you're absolutely correct as far as the data. Olga saying that it is God's love supporting the community in need of food. And we have somebody from the Philippines who is also watching this program. Life expectancy, Selena mentioned, that just changed my whole perspective on foods I allow into my body. Definitely will share with friends and families. It make a huge difference. So there are, later on, probably in the next 10 minutes, we're going to be asking you to make comments, or also you can ask questions in the next few minutes here. But I'd like to turn to Autumn here. Autumn, you said you're a farmer, right?
Yes.
Man, that is, you're a professional gardener, you know. So what do you think is making you more excited in this program that we are launching together from the farmer's point of view and from the nutrition point of view?
Sure. I would say, from the farmer point of view, I'm blessed to have the farm. I was part of the Equitable Food Access program with UNEC. We received a large amount of funding from Anthem Foundation to get us started, along with several other farmers in our area, so that we can increase access to fresh, chemical-free, organic food in our community. So, from the farmer's perspective, being able to form partnerships for things like data, because I'm not a data person. I'm a qualitative data person. I want to be interfacing people that I'm communicating with and hearing straight from their mouths. But I need the data to get the funding, as Greg said, to be able to do what we're doing. So when I can link up with organizations like Faith, Hope, and Love, and like Eskenazi and UNEC, we're able to expand the work that we're doing and have a greater effect on our community. So this project, I'm so excited to have three partners that I've worked with in the past to build out something that we can replicate on multiple sides of towns, so throughout the county. So so from a farmer's perspective, having good partnerships, having people who can do the data, having people who can do the organizing and coordination while I'm out there picking vegetables is really helpful. So I would say that would be my part.
Well, we appreciate you. That's not a small part. That's a big part
Yeah.
of, the nutrition and the
The
healthiness of,
nutrition part, I forgot about the nutrition piece. So there's several of, as working as the community builder, several of the neighborhood association leaders and DIPN Diabetes Impact Project steering committee members, they suffer from chronic disease. They suffer from diabetes, heart disease, and other ailments. So, being able to have a space where they can come to, we have a walking trail also that they can come and access anytime. Just being able to educate them as needed, or if wanted, specialized diets. We've had clients or neighbors who couldn't have certain foods because they had dietary restrictions, and we're able to tailor their meal kits to their dietary needs. So I think that's our main focus, is to make people healthier. And through healthcare organizations like DIPN, like Eskenazi, we're able to access more people who can benefit from that.
Wonderful. Thank you, Autumn. I'd like to have your attention. This is our SaltView software, and we've been using this. And at the end of the year, we have this big elaborate analysis of all the what we found out. This is actually information from the south of Indianapolis. And the reason I'm sharing this with you is that some of this will be also reflected in some of the reports. It talks about the gender, the demographics, the ethnicity. We're going to also do that here in the Northeast corridor, the age distribution, childhood and vulnerability. It tells what percentage is the childhood vulnerability. Social context, you may think about just physical, about food, but it has a lot to do with the social context compared to suburbs, rural areas, and beyond. And then also the vulnerability on this group of one food pantries that I brought here on the report, is that 73 out of 100 is the community vulnerability index. So I just want to share this with you because, again, we're talking about, again, food access and also the deliveries of nutritious food. But I'd like for you to start really understanding that what happens in here has a lot more to do. So what does a score of 73 out of 100 mean? This result indicates that the community served faces multiple risk factors simultaneously: sustained economic pressure, significant family burden, and constant exposure to complex urban environments. This is not an isolated risk. It is a convergence of vulnerabilities that reinforce one another. So we're talking about, Tiara, we're talking about, yeah, food. Food is the basic human need. You know, it's just like air. You get desperate, you do whatever you need to do. And that's why there's social, there's physical, there's social, and also economic, ramification on this. So could you talk a little bit about the vulnerability and also what you have seen from the healthcare perspective?
Absolutely. So Eskenazi Health has really been committed to serving the most vulnerable populations in our county. So this is not necessarily new work for Eskenazi Health, but I think with what we're focusing on through the health engagement zone, we're thinking not just about food. So when we started our process, we really broke things down into 8 different social determinants of health. So we're also thinking about safety, transportation, mental wellness, and a few other categories. So we're acknowledging, food is a top priority for sure, but that's not the only thing that is keeping people from living the quality of life that they should be able to have. So one of the things I also like to touch on thinking about this project and the different social determinants of health is that this is a pilot. So this is where we are starting. We do also have 2 other projects in this corridor and then other projects around the city. So we are focusing on different social determinants, but we don't intend on stopping where we are. So we want to make sure that we come back to the community, that we are checking back in on the information that we collected in this planning process and seeing what else we can do to implement change, programming, partnerships in those other areas of social determinants of health.
That's wonderful. So in the next 5 minutes, you can ask questions or comments, but for the meantime, we're going to talk about the impact, the effect of food insecurity. So there's a correlational analysis between food insecurity and mental health. So once you start talking about mental health, you start talking about the condition of the city. And so we talk about generalized anxiety when a person is food insecure. Severe depression could happen, emotional exhaustion, and community trauma. Now, again, not just individual, this could become collective trauma. And the cost of inaction, and this is when I mentioned earlier that it's about $1,834 in healthcare costs compared to someone who is food secure. So what we do here, and you as food pantry, food access organizations, have a lot to do in the community. And for this particular food, one food pantry south side of Indianapolis, if you multiply the individuals that they serve there for a year, multiply that by 1834, they actually saved $3,884,412. $3,884,412 for that particular group. So think about that, about the labor productivity. People who are food insecure, they're thinking about their family and they're not as productive. Maybe even, they may be a liability for, especially if you're driving heavy equipment and your mind is not there. And then cost of inaction based on the education and human capital. That has a lot to do. Public safety and criminal justice. It says here the average cost of incarcerating one person in Indiana is about $20,000 to $25,000 per year. And we know that desperate people do desperate things. And if you are desperate food-wise, then you may do that is direct and well documented correlation between extreme poverty, food insecurity, and property crimes. So for those of you who are thinking about, wow, what's going on, we would like for you to be part of the solution also. Don't be just like an observer or maybe just saying something, but we would like for you to be part of the solution, because as what Tiara mentioned, this is a pilot program, because we can provide you information based on the data and based on also on what we are gathering here, the total return on your investment. I tell you what, this has a lot of total return on investment. So I'd like to, again, one more minute here, the power of data as a strategic advantage. So thinking strategically, data is needed for what we do. And so conclusion, an investment with human and economic returns, strengthen community stability, protect children, reduce family stress, expand regional impact. And again, as we start thinking about, this is a pilot program, but also maybe we may expand in other places. So looking forward in the future, Tiara, where do you see this thing going?
Looking forward to the future, I think we definitely feel like we want to be able to expand on our community-based relationships with our community organizations to keep this work going. Where we're at, we want to definitely attract investment to this area, so that we can prolong the work that we're doing, so that we could expand to other areas, so that we could expand maybe what these offerings are for this program. But like you said, we definitely can't do any of that if we don't have the data to support what we're doing. So I think that's a really important message as well, to just let people know that we aren't using this data for nothing. This information is vital to make sure that we can provide you the best resources.
For the participants, again, I just want to reiterate it that we need your help. It's for the benefit of not just a family, not just a neighborhood, but for our community as a whole. So it's a cooperation, and again, this program is not to enable individuals, but actually to empower individuals. But we cannot do it without your help. So if you are a participant, if you are a community organization here in the Northeast Corridor, or maybe in Marion County, you can contact us to learn more about. Again, this is more than just the food access, although that's the base of what we're doing here, and we can provide you more information. So Greg, what do you think the impact of this in the next 6 months?
So in the next 6 months, I think this program, or at least this pilot, will have a significant impact, definitely to its participants, but hopefully it'll also impact word of mouth that Eskenazi is not only just a hospital or a medical facility, but they're also working very hard to get into the community and meet those community needs head on. Hopefully with this pilot program, we do find support and funding to keep it going for the next 5 years, especially when we're dealing with situations with people getting kicked off food stamp rolls at the state level, the federal government cutting back on food programs, heaven forbid, another major government shutdown where our food pantries are overwhelmed with more and more people looking for food each month. Mm-hmm. So hopefully this could really be a catalyst to show how we can distribute healthy, nutritious food to individuals in the Northeast Corridor, but hopefully over time and in the next 6 months, we prove this program to be successful, and then we can spread it to other parts of the city.
I'd like to ask Autumn. What do you think, Autumn? What do you think about our conversation? And also give us some wisdom as far as what you're seeing in the future.
Well, it's my dream to be able to somehow put something together here for our clients at Horizon House as we're housing people right now with the Streets to Home effort through the city that I'm sure it's been all in the news. These people that we're housing, they have 12 months. They have a 12-month subsidy, and then they're on their own. So it's our job as intensive case managers to get them ready for that, to be able to self-sustain. And that includes food. A big part of our job is going to food pantries. Gleaners and Second Helping serves the day room where over 200 people come through every day, and they're able to provide 2 meals to them. So what would meal kits look like for our clients? So not just everything that we're already doing in the Northeast Corridor, we're moving people into the Northeast Corridor as well. But throughout the city, we're moving people in, and they have 12 months to gain enough income to sustain $1,100 a month rent for a 1-bedroom apartment. So for me, food, that's something that we can help with, that they don't have to pay for, that doesn't come away from their income. And their health disparities are just phenomenal. So I'm excited to be working with Eskenazi. We're briefly talking about this, but I think that, other organizations, service organizations could really benefit from programs like this as well.
Wonderful. So there are some comments here. A lot of people commit crime just to provide food on the table for their families, unfortunately. Another person said, how would an organization or corporate entity partner with FHL and Eskenazi, and of course, from the ground up food to replicate this program? This program should definitely keep going. So I would like to answer that. You can contact us. You can contact Faith, Hope, and Love, UNEC, Eskenazi, if you would like to be part of the solution. Again, we need to change our mentality, our mindset that, hey, we are consumers, but you know what? There will be no consumers if there are no providers. And I would like to encourage you to be part of that solution, that it's not only financial also, but financial is needed, but it's not only financial. You can come over with your expertise. You may be a gardener, and you can talk to Autumn regarding that, or maybe you may have a land, you may have a building for convening people with our programs such as Beyond This Hunger, and you can support the data, the salt view that we have, and also what Eskenazi is doing, and just come talk to us. And we would welcome you to participate in this groundbreaking initiative that Eskenazi and Health and Hospital started. So last words, Tiara, do you have any encouragement or would like to share before we end this session?
Not too much, just that I am really excited to be kicking this off. I'm also really excited to already hear someone saying, this is something that we can do in other places. This is something that I would like to be a part of. And like you said, definitely reach out and we can think about ways to partner strategically to make these programs more sustainable and more widespread.
Greg?
All I have to say is that we can't do this alone. We got a good start going. We got a good idea going, but we need the support and help, especially of the food providers in the Northeast Corridor. I don't think I mentioned this before, but UNEC's portion of the project is we're updating our EFAI food resource list, and hopefully working with other organizations will actually make a map. Because so many times food pantries for 2 years, they'll be on Tuesdays and Thursdays and then switch it up to Mondays and Fridays. So we just want to be able to capture that information from the Northeast community food resource areas and build businesses and food pantries just to make sure that people have the right information to know where they can go and get help.
That's wonderful. Autumn, do you have anything else, last word before we end this session?
I would just say, again, that I'm really excited that this project is kicking off. We've been working on this for quite some time now, putting together the logistics behind the scenes. I'm excited that, we're going to not only just give people access to food, but also access to healthcare, because the Eskenazi Grandy building is new. There's probably a lot of people that haven't been linked up to it yet. And so I'm excited to see those connections be made.
All right. So before we end, again, we'd like to send a call out there that we can do more together rather than just small group of people. You may be wondering, well, why wasn't I invited or whatever? This is your invitation. You know, this is just a pilot program. We're just starting, and we need you even now, and especially in the future for the sustainability. And that's what Greg mentioned, that Indianapolis is one of the least healthy.
I said earlier, it was the quality of life was one of the lowest in the country.
So if you're listening, if you live in Indianapolis and you hear that, the statistics that Indianapolis is one of the lowest quality of life in the nation, I think that has something to do with, I'm not putting blame to others, but we need to come together. That you have something, you have God-given gifts and abilities, and also resources that you can be part of the solution. So next time we're going to be back again, second Thursday, for the 126 Table Talk. And I'd like to thank Tierra, I'd like to thank Greg, and also Autumn for being part of this. And again, you can contact us, Faith, Hope, and Love, or Eskenazi, or UNEC, or maybe even Autumn with From the Ground Up. So I'll end with prayer, and then we'll end this program. God, we thank you for this conversation. Thank you, Lord, for the resources that you have provided. And Lord, I just ask now that you open the gates of heaven, the windows of heaven, and shower us with the resources, not for our own benefits, but for the benefit of our neighbors, for the benefit of our community. And Lord, let this be a start of something big here in Indianapolis, for the sake of your name and for the sake of the neighborhood. In Jesus' name, amen.
Yeah.